Hi there. I just wanted to do a quick video for anyone who might be thinking of doing ketamine and rTMS for depression and anxiety. I was on antidepressants for about 20 years and I've tried many different kinds. Sorry, I've got some notes here in case I just want to make sure that I don't forget anything important. I've tried many different kinds, and within the last year I just really got a bit worse and not able to string the thoughts together, or wasn't very productive, and I was eventually then also diagnosed with ADHD, put on ADHD medication, and then again tranquilizers to offset the ADHD medication side effects. So I read about the ketamine and rTMS and decided to give it a try. At first I thought it's some kind of hocus pocus, you know, it just doesn't make sense. Anyway, so I wrote down a couple of things that I was feeling before I started. And before I started, I was feeling kind of hopeless, and everything was a task. Getting out of bed, doing mundane things was just a task. So I've just completed 10 sessions with Dr. George Mikellides. I hope I've said that correctly. He is in Larnaca in Cyprus, a psychiatrist, and he offers the rTMS and ketamine together as a therapy. I went twice a week, and obviously I was a bit nervous about what would happen once I'd been given the ketamine. But for me, and I'm sure it's different for everybody, it sort of put me into a bit of a dream state. And I was able to access a lot of emotions that they generally will be buried so deep down, where most of your life you'll intellectualize stuff and do CBT and write letters and burn them, and you think that you've dealt with stuff, but you actually haven't, you know, reasons that you may be anxious and that kind of thing. Since I've done the sessions, like I said, I've completed 10. I feel a lot more energized, I've started drawing, which is something I never ever thought I could do. Horse riding, making plans for the future, looking forward, that kind of thing. So I want to mention also that the 4th session that I have was pretty tough. I battled a bit with that one. And Dr. Mikellides, as well as his receptionist, literally sat with me and held my hand and spoke me through it. They were absolutely amazing. And this is why one of the things I want to mention is that it is exceptionally important that who you go to when you do this, because you put yourself in a vulnerable state, it is incredibly important that it is a trustworthy doctor who knows exactly what he's doing and who has the care he can give. For me, it's been the only thing that's worked. So I would highly recommend it. If by any miracle chance you're able to fly to Cyprus and go to Larnaca or to Nicosia, he has an office in Nicosia, I would definitely do that. Otherwise, just make sure whoever you go to is well educated, knows what he's doing, is compassionate and caring, like Dr. George Mikellides, like I said. Thank you and good luck.